In August 1969, over 400,000 people got together in Bethel, New York for the Woodstock Music Festival. The Woodstock Music Festival was not only a pivotal moment in music history, but it was also a defining moment for the hippie counterculture of that generation. The festival was named an Aquarian Exposition, 3 days of peace and music. But the audience wasn't only there to listen to music, they were also there for the experience. And part of that experience included drugs such as LSDs and psychedelics. As LSDs and psychedelics became popular in the 1960s and 70s, they also became criminalized, which had a detrimental effect on science, because any research that was being conducted for psychedelics came to a halt. Once they were criminalized, there was no more funding for the scientific community, and so now there's a lot of gray areas surrounding psychedelics. But now we fast forward to today, where research is actually being conducted on using psychedelics as a therapy option for certain mental disorders. It's just as controversial as using cannabis as a therapy, but a lot of the effects have been promising. So, in today's episode of NeuroPsyQ, we're going to talk about what psychedelics are, the active ingredients in the drugs, some of the research that has been done in the field, and how they might be therapeutic in people with mental disorders. So sit tight, stay tuned, let's roll the intro. Welcome back to NeuroPsyQ. Thanks for joining us for another weekly neuroscience video. If you're new to the channel, we post videos every Saturday, so make sure you subscribe and stay tuned for more. Today we're talking about psilocybin. Psilocybin is the active ingredient in magic mushrooms, one of the drugs that was popularized in the 1960s and 70s for the popular hippie counterculture of the time. Psilocybin is actually a prodrug, and what this means is that in its form, its normal chemical form, it has to be metabolized by the body to become active. Now, once it is metabolized, it becomes psilocin. So psilocybin has a phosphate group, whereas psilocin has that phosphate group cleaved by a phosphatase enzyme, and it becomes psilocin. Now, the acidic environment of the stomach is actually quite favorable for this reaction to happen with the phosphatase. Both psilocybin and psilocin are serotonin agonists. Now, serotonin is a neurotransmitter in the brain that is important for mood regulation. Since psilocybin and psilocin are serotonin agonists, they both actually directly bind to serotonin receptors and would cause the same effect that serotonin would have on the receptor. The only difference between psilocybin and psilocin is that psilocin has a much greater binding affinity for the serotonin receptors. This just means that it binds tighter. This molecule is actually highly polar, and so it can pass right through the blood-brain barrier and elicit an effect directly on the brain. As we said earlier, psilocybin was actually researched quite a bit in the 1960s, the late 1960s and early 1970s, until it was criminalized and scientists lost their funding for that specific research. Over 100 species of mushrooms can produce psilocybin, specifically from the genus Psilocybe, and it has low physiological toxicity and low abuse liability, which means even though this drug seems to have profound effects on individuals, it's actually not very addictive. The reason why psilocybin was made illegal was because of the negative effects seen in some individuals. If you've ever heard of an LSD trip, or when people take shrooms and they say they're hallucinating, people claim that they feel some sort of mystical experience throughout, and that everything in the universe is connected. If you actually want to see people that have taken psychedelics explain what it's like, I encourage you to go to the Hefter Research Institute website, where there's a lot of patient advocates that speak about their experiences with the drugs. Now, how is psilocybin working? We already talked about how it's cleaved into psilocybe, and psilocybe acts in 3 major areas of the brain: all of them have to do with the serotonergic pathway. First of all, it binds to serotonin 5-HT2 receptors, and so these are postsynaptic receptors. What that means is you have a neuron and it communicates with another neuron, so postsynaptic would be the receptors that are on the receiving neuron. So the neuron that is receiving a signal has these receptors that serotonin binds to, but psilocybin can also bind to these receptors and elicit the same response. This actually has complex manifestations in consciousness because this influence will actually then affect glutamate signaling in the brain. And glutamate is an excitatory neurotransmitter. And so if we have influence on the excitation in the brain, then that can throw off neural connectivity and change the perception of the world. Not only does it bind to 5-HT2A receptors, it also binds to 5-HT1A receptors. These are presynaptic receptors in an area of the brainstem called the raphe nuclei. And so the raphe nuclei release serotonin and it releases it to the rest of the brain to influence serotonin levels throughout the brain. So these are presynaptic receptors, which means they are on the neuron that delivers the signal. So this is the neuron that's sending the signal. What happens is we have binding to that neuron. That's like feedback to the system to tell the system what is going on, how much more serotonin needs to be created, stuff like that. And so by influencing these presynaptic receptors, we influence serotonin throughout the whole brain. Again, with the 5-HT2A receptors, they bind on areas in the reticular nucleus. So the reticular nucleus is an area in the prefrontal cortex, and it regulates sensory input to the brain. And so this area, when it's affected, causes a cascade that influences the relay of sensory information to the brain. So we have an area that's responsible for sensation. Now we have this chemical binding to that area, changing our perception of reality. And so that can have to do with some of the hallucinations that may be seen or the altered experience of reality. But aside from the illegal use of psychedelics, what kind of ways can they be used to help people? At the Johns Hopkins University, they're actually looking at using psychedelics to treat treatment-resistant depression, addiction, and cancer-related psychiatric distress. So first of all, looking at treatment-related depression, there was one study that we're going to talk about today. We're going to talk about a study for each of the three things I named, but the first study looked at individuals who had depression. So treatment-resistant depression is when somebody is depressed but they don't see any sort of improvement with any of the traditional therapies like psychotherapy and cognitive behavioral therapy. What they did with psychedelics is first they gave individuals a low dose followed by a high dose, and then up to 3 months later they actually saw improvements. So they did a lot of follow-up where they were looking at ratings of depression. So this was a preliminary study. It didn't look at too many patients, but if we see the follow-up 1 week after treatment, there were significantly lower ratings of depression than initially at baseline. That was sustained up to 2 weeks, 3 weeks, 5 weeks, and 3 months later. When we look at each of the patients individual, there were only 12 patients, and we see that the response did vary. Some people stayed consistently lower, whereas 2 of the patients actually seemed to start to approach depression again, with only 1 of them passing into severe depression. But they were all still mildly or moderately depressed. It's just that the psychedelics helped to lower their rating of depression, which is quite big when we say that these were individuals who had treatment-resistant depression. And so if it's lasting up to 3 months later, perhaps some sort of therapy can be developed that can help these people in the future. Now, there's also fMRI studies that were done for treatment-related depression, and so they looked at cerebral blood flow and regional oxygen in the brain, and what they saw was that there was decreased blood flow to the amygdala in depressed individuals after treatment with psychedelics. So it followed like the same treatment plan as the first study, but this one was looking more at neuroimaging to kind of see what is going on in the brain afterwards. They also saw less activity in the default mode network. The default mode network is a network that's activated by meditation, and it's what our brain turns to when we're daydreaming. So in depressed individuals, their default could be detrimental. Perhaps their thoughts are always spiraling around sadness and depression, and so reducing activity of the default mode network could be beneficial, and it could be part of why we're seeing positive effects. But also, a decrease in the activity of the amygdala is important because the amygdala is an area responsible for fear, and so fear and stress can help to elevate depression. So by having a less active amygdala, this could help reduce stress and fear, and perhaps be a reason for the reduced depression. Moving on to addiction, the study that looked at addiction was looking at nicotine addiction, so smokers, and what they saw was that there was a significant reduction in cigarette use. Some people actually quit cold turkey, and for the people who didn't quit, they did significantly reduce their intake in number of cigarettes per day. So as you can see in this figure, we see that overall, if we look at the average, the intake was significantly reduced. And then what they did was they took all the people that didn't quit and they compared their original intake to their final intake, and it was significantly reduced. With that reduction, another study was being done, and Dr. Griffiths talks about it in his TED Talk, where he says addicts were being treated with cognitive behavioral therapy, and you can see that at the beginning they are still smoking, and that was tested by looking at the nicotine levels in their body, but they set a date that they were going to stop. And so with the psychedelics and the cognitive behavioral therapy, most of the patients actually completely quit at their cutoff date. So they were still smoking and there was no change at the beginning, but at the day they said they were going to quit, that was it. We're not sure why this is all happening because, as I said, the research was cut off for a while and these are just preliminary studies, but basically the take-home message is that we need more research in this area if we want to develop viable therapies. But also, while we talk about this, I want you to question if you think it's something that should be researched further, or if it is an idea that we should totally scrap, looking at the preliminary studies that have been done. The final thing is cancer-related distress. So with this, it's kind of related to depression again, because what happens is people that are diagnosed with cancer and they have this life-threatening disease, that is obviously going to affect their mood. And what they did was they took 52 participants that had cancer, but they also needed to have some sort of ranking on the DSM-4 for anxiety and mood symptoms. Then the patients were split up into either a high or low dose condition for Psilocybin, where they were given a high dose if they were in the high dose and then waited 5 weeks, and then the second dose administered was a low dose, or if they were the low dose condition, they started with the low, waited 5 weeks, and then were administered the high dose. So what did this study look like? Basically, they started off by getting acquainted with the two therapists that would be with them while they went on their trip. And so this has a very important role because it's adamant that the patient has trust with the therapists, as sometimes there can be adverse effects of psychedelics, and if somebody's experiencing fear in the moment, then it's important they have someone they can trust with them to help guide them through that. The next thing was the Psilocybin session, and now this wasn't done in like a cold hospital setting. It was done in what would look like a family room. So the patient was encouraged to lie on a couch and wear a mask, and you can see it in the figure right here in this image. The individual lies on the bed, they're encouraged to wear a mask to cover their eyes, and they also listen to their choice of music, classical or meditative music. And then they just relax until the session's over. Now, what were we measuring throughout this? They were measuring cardiovascular things, and they did 4 tests for the experience when on psychedelics. So they looked at the 5D altered state of consciousness. They also looked at a mysticism scale, a mystical experience rating, and hallucinogen rating scale. So 4 different things to look at whether or not they experienced some sort of mystical experience. And then they also looked at anxiety and depression ratings, and afterwards there was a 6-month follow-up. So the 6-month follow-up not only asked the patients how they felt, but it also asked family members for their accounts of how the individual is doing. If we look at heart rate and blood pressure throughout the experience, we see that it peaks at a point. For the high dose, obviously there's a greater peak. So this is showing that there is some sort of dose-dependent curve for the response to the drug. And if we look at the depression and anxiety ratings, you see that there was a drop in depression and anxiety throughout, and there was also improved quality of life. So we see drops in depression, drops in anxiety, and improved quality of life. If we compare the low dose first versus the high dose first groups, the high dose first seemed to show a greater response than the low dose first in all situations. The people who were given a high dose first fared better. Now maybe this happened because the low dose actually got them desensitized to the drug, and so the second dose that was a high dose didn't have as great of an effect. That could be the reason. Maybe the high dose right off the bat is important to give them such a huge mystical experience that it changes their outlook on life. We don't know. People then ranked how meaningful the experience was to them. 80% of the individuals rated it as their most meaningful spiritual experience in their life, and for most of them it fell within the top 5 most meaningful spiritual experiences in their life. So we see these effects on cancer patients, on people with treatment-resistant depression. We even see it helping addicts. But why is it doing this? Now, one of the most important theories about depression is the monoamine theory of depression. It's widely accepted, and it states that there's some sort of imbalance in the levels of monoamines in the brains of depressed individuals. And so this would be things like serotonin, dopamine, and norepinephrine. So we said that psychedelics are serotonin agonists. And so this influence on the serotonergic system could be benefiting that. A more interesting proposal is that it may actually be influencing the fibrinolytic system. Now, this is a new theory that is being proposed for depression, and it is that the fibrinolytic system is involved in depression. And this is an immune system that is involved with removing clots after vascular damage. So if we have vasculature healing and there's clotting, the fibrinolytic system removes the clots. So how could this be involved in depression? Well, stress can actually cause an increase in pro-inflammatory proteins, and this would inhibit the plasminogen activity, and this could also affect the formation of brain-derived neurotrophin factor. Now, with depression, we also see compromises in the formation of brain-derived neurotrophin factor, or BDNF, and neurotrophin growth factor signaling. So there's this 2019 study that looked at how the fibrinolytic system could be involved with depression, and so what they saw was that tissue plasminogen activator actually cleaves neurotrophic factors. So the pro-BDNF and pro-NGF are cleaved by tissue plasminogen activator, which forms BDNF and NGF. And TPA also binds to lipoprotein receptor-related protein 1 receptors and promotes neurogenesis and neurite growth. So the study looked at mice with chronic unpredictable stress, and then it looked at mice that were injected with lipopolysaccharide that would cause inflammation of the brain. And so they wanted to see if the unpredictable mild stress brains looked similar to those with inflamed brains. And in the end, they actually did look similar. But then what they did was they compared it to individuals that were experiencing depression. And these people experiencing depression actually had similar levels of tissue plasminogen activator as the depressed rats. So the rats that went through chronic unpredictable mild stress and lipopolysaccharides to cause inflammation of the brain were tested for depression. They showed depression through a forced swim task and a glucose preference test, which are common tests for depression in rats. These rats shows depression, and the depressed individuals also obviously had depression, and so both of them had low levels of tissue plasminogen activator, which then would mean they have low levels of brain-derived neurotrophin factor and TGF. So they looked at all this, and it's a great paper. It's very interesting. They thoroughly examined the mRNA with PCR, and they also examined the protein levels as well, not just leaving it at an RNA level. And they looked at the proteins with Western blots, and they saw that there are these changes happening in the immune system when we experience depression. Now, what does this have to do with psychedelics? Well, another paper came out just last year looking at this system, and they proposed that perhaps psychedelics are influencing this system. They didn't do an actual study, but they proposed their hypothesis about how psychedelics may be working based on the fibrinolytic proposal. And so there's all this new stuff happening in the field. So that's something I encourage you to read about, the fibrinolytic system, to help your understanding of depression, and then read more about psychedelics. So why am I saying all this? Well, what I'm getting at is that we don't understand, and I know that's not what you want to hear, but we don't completely understand depression, and we don't completely understand psychedelics yet. More research is needed. We're coming out with this new theory, the fibrinolytic theory, and people are already proposing that maybe that is how psychedelics work. So it's important to stay on top of readings when you're in the scientific community and stay on top of the field, because things are constantly changing. We're learning more and more every day. But despite the fact that we still need to learn more about the field, there are actually clinics that promise to cure people of their depression and other mental disorders using psychedelics. In fact, there is one in Toronto already called Field Trip. I was surprised when I heard of this because I had heard of ones that had popped up in LA, but I didn't think we had one in Toronto. There are a lot of patient advocates that claim that the psychedelics are helping their depression. So people are using it. People are turning to psychedelics as a last resort, even though we don't have science that completely backs it yet. So with that being said, I want you to maybe leave any comments you have on how you think the psychedelics are changing people's outlook on life, maybe what some of the mechanisms are on, what could be going on in the brain. And as usual, like, comment, subscribe, and we'll see you next week for another video. Thanks for watching.